to the webinar. Today we are presenting VA healthcare benefits, and we have James Arrington with us. He is the Veterans Service Center Manager at the Samuel S. Stratton VA Medical Center here in Albany, New York. And it looks like we had some technical difficulties, sorry about that, but it looks like we have everybody back. So we're going to go ahead and get started, and I'll put James Arrington on.
Okay. Good morning. It's James Arrington. Glad to be with you today. Happy Friday. We're going to be going over the VA healthcare benefits presentation, and there's 4 things that I want to point out that most folks want to know about a VA medical center. They basically want to know who's a veteran, what are they eligible for, where can they receive their care, and basically what do they have to pay when they receive treatment at a VA facility. So hopefully I'll cover all those in my presentation. First, who's a veteran? That's anyone who served in the active military or discharged or released under honorable conditions. This includes our former and current reservists and our National Guardsmen, if activated and served the full period for which they were called up for. So more specifically, if a veteran goes over to Afghanistan or Iraq and they're a reservist or a National Guardsman, they will qualify for VA health care. But if they remain stateside, they will not qualify for the health care benefit. There's 2 basic veteran statuses. We have what we call the non-service connected veterans, and those veterans have no injuries or illnesses that were incurred while they were in the military. And the service-connected veterans are completely the opposite. They have an illness or a disability that they're currently being compensated for. That defines a service-connected veteran. Establishing eligibility. Our veterans can apply for VA healthcare by completing the application, which we call the 1010EZ. They may apply in person or show up at one of our community-based clinics, or they can submit an application to the VA through mail, or they can register online for VA healthcare. VA healthcare is based on a veteran's military data. We ask the veteran to provide us with a copy of their discharge papers, which we call their DD-214. But if the veteran does not have a copy of the discharge papers, we have other ways of verifying their eligibility. So although we appreciate it, it's not required. Veterans must generally be enrolled to receive VA health care. This ensures that they have a comprehensive health care services. Enrollment allows the health care benefits to become completely portable throughout the VA system once they're enrolled. Enrolled veterans do not have to repeat the application process. We have ways of working with other VA facilities to update information for veterans who happen to be traveling through an area that's not their primary treatment facility. The Veterans Healthcare Eligibility Reform Act of 1996, this law basically requires the implementation of an annual enrollment system to ensure treatment is timely and acceptable. This resulted in 8 specified priority groups, with priority group 1 being our highest priority patient. And once veterans are enrolled, they can receive a standard medical benefits package that's available to all our enrolled veterans. Quickly, I'll go over the priority groups 1 through 8. Veterans in priority group 1 through 3, veterans that are with service-connected disabilities that are rated more than 50%, those are our priority group veterans. Those veterans in that priority group, they don't pay for their health care or their medications. All their health care is free. And the veterans in priority group 2 and 3, service-connected 30% or 40%, and our priority group 3, service-connected 10 to 20%, and this includes the Purple Heart veterans, the Medal of Honor recipients, and former POWs. Veterans in these 2 groups don't pay for their health care, but they are required to complete a financial assessment to determine if they have to pay for their medications. Priority group 4 through 5. These are veterans that are receiving aid and attendance or housebound, and they're determined by the VA to be catastrophically disabled. And then priority group 5 is our non-service connected veterans and our 0% service connected veterans with incomes that are below the pension level. This is the biggest population of our veterans. As you listen to my presentation, you will hear that our target population veterans are veterans with disabilities and veterans with low incomes. And so veterans in priority group 5 are required to complete a financial assessment to determine their eligibility for VA health care benefits. Priority group 6, also we have the compensable 0% service-connected veterans, those that are exposed to Agent Orange, and veterans exposed to iodine radiation during atmospheric testing and during the occupation of Hiroshima and Nagasaki, and any other recognized environmental exposures. Also in priority group 6, we have the returning combat veterans. These are the guys that are over in Afghanistan and Iraq, and when they return to stateside, they're eligible for VA health care for 5 years post-discharge. After the 5 years, it will be based on whether they have a service-connected disability or based on their financial ability to pay for their care. The reason for the 5 years is that's about the length of time it takes from the time a veteran files a claim for a disability until a decision is made to award a service connection. Priority group 7, these are veterans who agree to specify co-payments with income and net worth above the VA income threshold. Also, this is the same for the priority group 8 veterans. These are higher income veterans, and they're required to make a co-payment for their care. But I want to point out that on January 16, 2003, the regulations changed. Veterans that are applying for VA health care after that date, it's based on their income or whether they have a service-connected disability. Veterans that apply for VA health care prior to that date are considered grandfathered in, and they will be they'll remain eligible for VA health care. It's just that anyone applying after the 2003 date is based solely on their income.
So I have a question.
Sure.
When you talk about these priority groups, is priority in terms of who is made eligible, who's enrolled into the system?
Right.
So does that mean that there are people who are waiting to be enrolled?
No. The priority group basically means that those are our priority patients, and they're the ones that we take care of first. All the veterans are enrolled in the system, but the priority group, like the priority group 1 veterans, they don't pay for the health care. They don't pay for the medication. That's a priority patient. And as you go down the list, you look at priority group 5, and these veterans don't have to pay for their health care. And so from the top down to it's priority down to 8. Now, going to priority group 8, that's our lowest priority group veteran. Right. That means they pay for their health care. They pay for their medication.
Right. So the priority group, the priority in the priority groups really means priority in terms of how much the person has to pay for
their care,
what their responsibility is for their health care.
Absolutely.
So the higher the priority, the less they pay.
Absolutely.
Okay.
That is
Thank
correct.
you. That helps.
What am I eligible for? Well, the VA, basically, we look at preventive care services. We want to manage your care before you get sick. So we have immunizations, physical examinations, including eye and hearing examinations, health care assessments, screening tests, and health education programs. Also, for outpatient and inpatient, ambulatory diagnostic and treatment services. We provide the same type of services that you would find at any tertiary facility. So we have medical care and surgical, which includes reconstructive plastic surgery as a result of a disease or trauma, and mental health services and substance abuse services. Limited benefits. One is ambulance services. Not all our veterans qualify for this benefit. They have to meet a specific eligibility for us to assume financial responsibility for an ambulance. Dental care, that's one of the 2 programs that the eligibility is very specific. Not all our veterans qualify for a dental program. they have to be at least 100% service-connected or being treated for a service-connected dental disability. Eyeglasses we provide. Well, eyeglasses and hearing aids are limited benefits because we only provide the examination for those two, but in order to qualify for eyeglasses and hearing aids, our veterans have to be at least 10% service-connected. We provide limited home health care and non-VA health care services. Non-VA health care services is basically when a veteran is looking for a service that we cannot provide at the medical center, and we will authorize that veteran to be seen in the community at our expense.
And who's eligible for those?
In order to qualify for that benefit, it's got to be a service that we can't provide. And when we can't provide it, we first look at one of our other VA facilities in New York, and we will refer the patient there. And then if they can't find, if they don't have the services there, then we'll authorize it locally. So basically, to answer your questions, it comes down to whether or not we can provide the health care at the VA Medical Center.
And what about the home health care?
Home health care is very limited. It's the same. Veterans that meet a specific eligibility criteria will be authorized home health care services. So, and it mainly has to do with their service connections and their income levels. Because basically, any VA health care is based on whether a veteran is service connected or if they could pay for their health care. So if you have a veteran that has a $100,000 income and he needs home health services, he's probably not going to qualify for that benefit. Exclusions: we don't pay for abortions, cosmetic surgeries, gender alteration. We don't pay for health club memberships or in vitro fertilization or drugs that are not approved by the FDA. And there's a lot of requests for veterans that are incarcerated. Incarcerated veterans, actually their care is the responsibility of the state or the county. And once they're released from incarceration, then they can come to a VA for VA health care. And we don't pay for private duty nursing care. Non-VA emergency care. At the Stratton VA, we have a catchment area, and it's from the Canadian border up to Malone, New York, from Malone, New York, all the way down to Kingston, New York, which is a huge catchment area. Some of our veterans travel to 2 to 3 hours to come to the VA Medical Center for their health care. And if a veteran's in the community and they have an emergency, the VA will assume responsibility if they go to a non-VA emergency room, provided they meet the criteria here. And that's basically a delay in getting immediate medical attention would be hazardous to their health or life. A veteran was unable to reach either a VA healthcare facility that routinely cares for the VA patients under contract, a safety net for veterans who have no other health insurance, and to qualify, a veteran must be enrolled in the VA healthcare system, seen by a VA healthcare provider within 2 years, and carry no health insurance. The key here is if the veteran has any kind of third-party insurance or has Medicare or Medicaid, they will not qualify for this benefit. So a truly uninsured veteran is really the target veteran for this benefit.
Now, with the Affordable Care Act, does that in any way impact, are the VA health care benefits considered one of the accessible health care plans?
No, it's two separate programs. Veterans are covered under both, but most veterans that are enrolled for VA health care, getting the care at the VA is probably the better benefit for them. Actually, when that Health Care Act came out, a lot of our veterans didn't jump ship. They remained with the VA because it's a better benefit. What do our veterans have to pay? Copay exemptions, those are veterans that are catastrophically disabled, former POW and Purple Heart recipients, service-connected veterans 50% or more, or veterans that are less than 50% have to make copayment for their medications. So these are the veterans that are exempt. Next slide. All other veterans, payment is based on their financial ability to pay for their care. Our veterans must complete a financial assessment to determine whether they pay for their care if they're not service-connected. So it's important that you understand our income levels for VA health care. if your income is above $31,978 and you're single, you will not qualify for VA health care if you're applying for VA health care after January 16, 2003. And if you're married, the income level is $38,374. So based on this information, again, you'll see that our veterans are either service-connected or they're indigent veterans. It's not a lot of money to qualify for VA health care. Next slide. Copayment continuation. For outpatient primary care, the cost is $15 a visit. And for outpatient subspecialty visits, it's $50 each visit. So what we try to do is encourage our veterans to bundle their appointments. For example, if the veteran has 3 appointments today and 2 happen to be subspecialty appointments and one's a primary care appointment, they would have to make one copayment for that day, and it's the one that's the most expensive of the 2. So they would pay $50 for that for 3 appointments on that day. For inpatient care per diem, hospital care is $10 per day, and for inpatient care, it's $1,290 for the first 90 days, and for inpatient care per diem for nursing home, it's $5 per day. Medication copayment. Our veterans in priority groups 2 through 6 are charged an $8 copayment for each 30-day supply of medications provided by the VA for a non-service connected condition. As I talked about earlier, priority group 1 veterans don't pay for their medications or their health care. And veterans that are in priority group 7 and 8, they paid $9 for their medications for a 30-day supply or less. The amount of copayment is payable in a calendar year is capped at $960 for the veterans in priority groups 2 through 6. There is no cap for our higher income veterans in priority groups 7 and 8. Health insurance. We don't encourage our veterans to give up their third-party insurance. As I indicated earlier, some of our veterans travel up to 2 to 3 hours for VA health care. If they get sick in the community and they need to go to a non-VA facility and they do not qualify for that non-VA emergency benefit, they can use their third-party insurance to be seen in the community. Our veterans that are covered by health insurance and they're seen at the VA Medical Center, if they're not treated for their service-connected condition, we can bill their third-party insurance for those services that are rendered. The collections that we get from the third-party insurance, it helps supplement funding for other needy veterans. Okay, where can I go to receive VA health care? Stratton VA is a parent facility. We're located right here in Albany, New York, over on Highland Avenue. And we have 12 satellite clinics. And at our satellite clinics, our veterans can receive primary care and some limited behavioral health treatment. But when a veteran needs specialty care, that's when they're required to come to the VA Medical Center for that treatment. Our locations are, we're in Bainbridge, New York, Catskill, New York, Clifton Park, Saranac Lake, Westport, Fonda, Glens Falls, Kingston, Malone, Plattsburgh, Schenectady, and Troy. We have 12 CBOCs, and Albany has more CBOCs than anyone in the country. Next slide. We're in Vision 2. Vision 2 is comprised of the 5 major tertiary facilities in upstate New York, and that's Albany, Syracuse, Canandaigua, Bath, and Buffalo, New York. And those sites are in Vision 2. And the other sites that you're looking at in black are all our community-based clinics in upstate New York.
What does Vision stand for?
Veterans Integrated Service Network. That concludes my presentations and and I will take any questions you may have at this time.
Okay, so if we have a transition specialist who are working with individuals who may be veterans, and those veterans primarily are going to be in nursing homes. So if we find somebody who's a veteran and we don't know if they're enrolled or what would be the best procedure for the transition specialist to take to find out if that person is enrolled in VA health care services?
Enrollment is one of the programs that I manage, so you can contact my office,
okay,
and we can provide that information for you. My number is 518-626-6721. That is my direct line. I will be available to answer that question.
All right. And for the other, because this is statewide,
I have a counterpart at every VA in upstate New York, and actually we're all online. So if you go online and you Google Veterans Service Center, it will come up with all the upstate New York VA point of contacts, as well as our pictures, so and our phone numbers.
All right, that's great.
Okay.
And you keep saying upstate. Does that mean there's a different system for New York City?
Yeah, they're in Vision too, okay. And I don't know if they call themselves downstate, but we call ourselves upstate New York. So you have Vision 2, which is Albany and the other sites I mentioned, and then you have the New York and New Jersey VAs in Vision 2, and out Boston is Vision 1. And very soon, Vision 2 and Vision 3 will be merging together.
Mm-hmm. But what it sounds like is that the VA healthcare services are fairly comprehensive, and that anyone who has an honorable discharge would be eligible, would most likely be eligible, but how much they pay for those health care services varies based on both the level of their service-related injury, if there is one, and what percentage, as well as what their income is.
That is correct.
And that, so for a transition specialist who meets someone who's low income and may or may not have a service-related injury, finding out whether they're enrolled in VA health services is an important thing to find out.
Right.
They would be able to access
good
medical care at a low cost.
Mm-hmm. Mm-hmm. You can contact us, and we can assist them with that. One other thing I want to point out is that the VA is we have this program that we call Income Verification Matching. And what that is, the VA is directly linked with Social Security Administration Internal Revenue Services. So whatever income our veterans provide to us, it's automatically matched through those two programs. So it's important for us when we register enrolled veterans that they be as forthcoming as possible, because if they receive care and they don't provide an accurate income, they can go after them for the services that they receive, and they will garnish their Social Security or their income. No, that's a vet center. The VA, I'm at the Veterans Service Center. I think we just type in James Arrington. Right.
And while we're getting this website up for you, do any of the participants online have questions for James? You're able to type questions right up. It should be on the right-hand side of your screen. All right, well, I'm not seeing any questions come up. But you can see.
If they don't have questions now, I gave my number out. They can always call and
find out.
Yep. And you found the website. There's my information, as well as my counterparts in upstate New York. So you may want to share that link with your folks.
Yeah, that's what I was going to say. So we will send the link out to all the transition specialists so they're able to contact the Veteran Services Centers. So if there are no further questions, that will conclude our webinar for today, and thank you for participating.